Hello. Um, okay, it's been a while since I've made one of my own personal videos. But since I didn't make a Naked Truth last week, it was all on music, depending on when you're watching this, and I've just never really gotten into it. And I am unsure whether I'm going to do this week's. Uh, Although I have said anytime I'm debating whether or not I should do something, I probably should. Wouldn't suggest this to most people, but I tend to talk myself out of some stuff, and I should probably talk myself into more stuff. Anyway, I've been thinking about. I've been planning on doing this for a while, especially the past week when I know I wasn't going to do a video. But if you watch my response to the Naked Truth on procrastination, you know I'm not really good with stuff because I always put stuff off. There's not a time limit. But since last week's topic was music, I will just say one brief thing about it. And while I am totally not the demographic for this person, there's a line in a song that out. Uh, I do hear. Well, I'm not into music. I do hear a lot of music. But I think this line is appropriate for people with social anxiety. I also think it works for YouTube when you hear about or see all the negative comments, and probably for anyone. Um, the line, I can't believe we're gonna say this, but a hater's gonna hate, hate, hate. Shake it off. I think it's good advice for anyone. You know, you whatever you like or whatever you do, there's always gonna be someone who has a problem with it. You know, and I guess I just feel you. It's not that it's just that easy to just shake it off, but it's something we should all do. Anyway, what I want to talk about is social anxiety disorder, since it seems obvious, since that's pretty much what everything's about. But I guess I haven't gotten really specifically into it. Uh, and what I really first thought about doing this was, I don't know, a month or so ago. Uh, I try not to look too much at whether videos have got thumbs up or thumbs down. I'm not really doing it for that reason. But curiosity got the better of me. At this point, I had, I don't know, 8, 10 videos up, and I looked, and there was one thumbs up, one like, and 3 dislikes. And I understand that, and I'm really uncomfortable in front of the camera. I figure my videos are pretty bad. So, I know one of them, I was talking about video games, so maybe someone didn't like my choices of video games. But two of the dislikes were for Naked Truth. So one was for my first video. Just my introduction on why I'm doing this, and it just seemed weird that someone would dislike a video about, I guess, someone sharing his problems. Even if the video was bad, like I get it if Naked Truth is bad, you don't know where I'm coming from. But if I'm talking about social anxiety, it just seemed weird. Although surprisingly, it didn't bother me. I was just kind of like, just had me wondering why. Maybe someone doesn't understand social anxiety. It's always hard to understand something you don't go through yourself. Um, so I thought a little bit about that. The difference between social anxiety and shyness. I actually looked that up a little. I did see one thing where they said that it's not the same thing. Not all people with social anxiety are shy, but then they went on to say some are extroverts, which I've read a little bit, read a little bit, read a little bit about recently, and that's applying that shyness and extroversion are the same thing, which it's not. That has extroversion has more to do with, I guess, wanting to be around people, while as with, I guess, if you're social anxiety, you don't, but it's because you're uncomfortable, not because you don't want to have friends or be around people. Anyway, so I kind of that was the only thing I saw really like that. The rest of it basically makes it seem like it's social anxiety is a really extreme form of shyness. So looking at this, I have some statistics here. They say, I guess the number they give is 6.8% of people of Americans have social anxiety disorder. Uh, what I read, most people say it's probably a little low. I've seen as high as 15%. Cause I guess it's one of those things that's hard to gauge. Uh, where they say about 40 to 50% of people consider themselves shy, and nearly 80% of people have felt shy at some point during their life. So I, was looking at social anxiety. Initially, I guess it was first listed in the DSM or DSM-3, which is the, if I can find the quote, the Diagnostic and Statistical Manual of Mental Disorders, basically the book of mental health issues, and it was first listed as social phobia. Uh, and in the DSM 494, they changed it to social anxiety disorder. Uh, I happen to like the term social phobia better, because with phobia, you think of an extreme but irrational fear of something, and I guess I realize my fears are irrational. It's just dealing with it that's been the problem for me all these years. Anyway, so their definition of shyness, and I'm just going to cut this down as opposed to the whole thing, is in the most recent DSM is a persistent fear of social or performance situations or being judged by others. Talk about an exposure to these situations. Because a lot of people talk about exposure therapy. It can actually have a negative effect. It provokes more anxiety and possible panic attacks. As before, a person realizes the fear is unreasonable. It interferes with your personal your whole life, work relationships, whether it's friendships or romantic relationships, which is what I have always heard. Basically, disorder is when something gets to the level of a disorder. It's when it's disrupting your life. Um, People with social anxiety will avoid situations that they think will induce anxiety. They also say it has to last longer than 6 months, and it can't be due to another medical condition or some form of substance. You can't if it's caused by drugs or medication, then I guess it's not considered social anxiety disorder. So that's, I guess, the technical definition of it. And I feel it's kind of like what's used for more than anything for drug companies to decide, or maybe insurance companies decide whether they will cover drug expenses or medical expenses. Uh, so anyway, a few more stats before I go into my own personal experiences with it. They do say it's the third most common health disorder behind major depression and substance abuse, both which are common though among people with social anxiety. Depression, obviously, if you're not living the life you want, can lead to depression, and a lot of people who have these issues deal, or any issues, deal with it, with drugs or alcohol. Uh, Although they say anxiety in general is the number one mental health disorder, just encompassing all anxiety disorders, not just social anxiety. Uh, 80% of people with social anxiety will have at least one other mental disorder in their life. I remember reading a while ago, someone actually said that sorry, social anxiety disorder is actually a form of OCD. Uh, I, I don't know if this is official, but their reasoning was it's you basically have this obsessive way of thinking. It's this, you don't need to turn a light switch on and off, 30 times before you leave the room, but the negative thoughts go through your head over and over again. In fact, a few years ago, while first time I was on medication, it was a social anxiety medication, but they gave me a booklet, and you flipped it over, and the other side told you it also dealt with OCD. So there are some at least commonalities between the two of them. Uh, Say 75% of people don't receive treatment for the social anxiety, and 36% of those who do will wait a long time, at least 10 years. I will tell you, I waited a long time, and what happens is once you get past a certain age, it becomes very hard to get help if you know what you're thinking about. About social anxiety, like phones, calling people on the phone, especially someone you don't know, is really anxiety inducing. So making an appointment with some therapist you don't know and talking about your problems, while it will help you in the long run, or hopefully help you in the long run, is not something that I guess you're likely to do. And I'll admit, I had help with this. Yeah, so I also say 70% of people with social anxiety are on the lower end of the socioeconomic scale. Uh, I'm not 100% sure of all these stats. This is just stuff I've read. I read it on the internet. Who knows if it's 100% true? This one seems a little high, but they said nearly 50% don't complete high school. 55% have no close friends. 60% don't keep in touch with their friends. I know I have those issues. I had a real close friend for a while, but he moved away, and now outside of family, I would say I don't really have any close friends. I have one friend who lives up here, but I'm not good at keeping in touch with him. I will admit a part of it's because of my work schedule makes it really hard to do. Uh, just it doesn't work out to hang out. My schedule doesn't work out to hang out with a lot of people. Uh, about half of all people with social anxiety have drug or alcohol problem. Getting back to what I said before about that being a one of the top mental health issues. And the typical onset for social anxiety is about 13 years old. So then there's the question of, can you be born with social anxiety? Because I'm someone who has felt I've had it my whole life. But then I heard, and this makes logical sense, is that you can't be born with it. because when you're a baby, you don't know to be you don't know enough to be anxious of social situations. You're not aware enough, so it has to be learned. Uh, that being said, I definitely believe there is a genetic part to this. Both my parents consider themselves shy. Not that I really noticed in my father, but when I was younger, I noticed it in my mother. Um, and her father uh, had mental health issues. I never met him. Because of that, she lost touch with him before I was born. So, and I have a cousin who has social anxiety and reminds me a lot of myself. So I definitely believe there's a genetic component to it. I also saw something where they said they tested infants and they said 15 to 20% of them appeared vi- visibly shy. They said they would seem distressed when faced with unfamiliar people or objects or events. So I don't know if you could technically be shy, but I think there is that component to your personality. Maybe if you don't get the right help early enough. Like I said, I've had it as long as I can remember. And my parents sent me to a few therapists when I was a kid. I'm talking elementary school age. The teachers would suggest sending me to a therapist, but I guess I would get comfortable with the therapist after a while. In the one-on-one setting, and the therapist would tell them that the teacher's just trying to fit a round peg into a square hole. But I think part of what happened was, as I said, social anxiety disorder, social phobia wasn't listed until 1980, and they said it really wasn't widely recognized until I think it was 1985. Um, as someone who was born in 1973, I was probably just considered a shy, different kid. Um, and so after I guess elementary school, I didn't see any type of therapist or anything uh, until after I dropped out of college. I'm not one of the 50% who didn't graduate high school, but I lasted a very short time in college between the anxiety and falling behind because of the ADD. I couldn't last. And I was trying to set up with this therapy place, but it ended up not working out after like 3 appointments. They said because I didn't have insurance, they couldn't deal with me. But it was the first time I had actually heard that medication could deal with my issues. And I'm not big on medication. I'll probably do a video on that at some point. I'm not quick to take it. I'm someone who doesn't even drink, but yeah, I mean the idea that there's something wrong with me that could be helped did make me feel a little better. But yeah, again, I didn't see a therapist again until my 30s. That 10 plus years, as I said. Uh, in fact, I had never even heard the term social anxiety disorder or social phobia until probably I was in my 20s. I remember seeing a commercial for, I believe it was Paxil, and they were talking about it, and I'm like, oh, actually, that sounds like me. Um, but I read other stuff about at least anxiety in general and panic attacks, and I remember hearing people talk about their panic attacks, and they were saying how they felt like they're having a heart attack. Uh, they thought they were going to die, and I thought, well, at least I don't have that. And then I started to listen to more of the symptoms of panic attacks. I also never realized a lot of them fit me. They talk about the pounding heart, the racing or accelerated heart rate, which I said in an early one. I even tested my heart rate once for my before actually sending out my first video, and it was like through the roof. Like if I had one running, you know, the sweating, that the nausea, you get that kind of like tightness in your chest, almost shaking, dry mouth. I remember I did anytime I had an oral report in high school, I just didn't do it. Except for one because it was it had to be done with someone else, so it was done with my friend. So I forced myself to get up in front of the class because I didn't want to screw over my friend. I remember when we were done, as you know, my mouth was dry and I was practically shaking, but drinking as much water as I can out of the water fountain. My friend even noticed how nervous I was. I mean, I just remember him making. I don't remember exactly what he said because this is going back, you know, 25 years. But yeah, that I guess basically having a panic attack. Then I guess I always consider those symptoms just being nervous. What I think happened, at least with me over the years, is it affects your thoughts and your behavior. You know, on more of a subconscious level. I think once you realize you're going to have these feelings, even though you may not be thinking about it, you tend to avoid things that will stir up these feelings unless you have to. I mean, obviously, sometimes it's conscious, but I mean, a lot of times, I think it is on a subconscious level, and it, I feel like it becomes a habit. You basically build a habit of doing it, and it becomes hard to break out of it. I feel the longer you wait to get help, the harder it is. The analogy I like to use is if you've ever seen The Shawshank Redemption. Uh, I don't want to give any spoilers, but the movie is 20 years old, so I think it's okay. Uh, Dealing with it reminds me of Tim Robbins uh, breaking through the wall with that tiny little pick. But I feel like the longer you wait, the bigger the wall gets and the harder it is to deal with. Um, yeah. So, I like I said, I waited until my 30s to really get help, and for me, it took two therapists. and I'm still nowhere near where I want to be. Uh, I, I feel like I am on the right path now. And this is, I guess, more about what social anxiety is and how to deal with it. There'll be, if I keep doing this, there'll be a few videos about that. Uh, yeah, so I guess that's about it. Thanks for anyone who who's sat through this whole thing again. I realized I'm never going to have any short videos here. Uh, I can't seem to do those 5, 10 minute videos like most people. Uh, yeah, I just thought I'd share some of my experiences and just some of what I found out, what have read about social anxiety. So again, thanks for watching, and goodbye.